Hi, Dr. Taj Khan. I'm the Medical Director of Edgewater and Hoboken Cosmetic and Laser Centers. Welcome. So my topic of discussion today is Radiesse versus Voluma. So I'll start with Radiesse. It's manufactured by MERS Aesthetics. I've been injecting it for close to a decade now. In my injection technique, I typically blend it down with a little bit of Novocaine mixed with epinephrine. And what that does is it affords me a much smoother application of the product under the surface of the skin. It also helps reduce bruising and swelling. So I love Radiesse to contour the face. So what I mean by that is where there's areas of volume loss, it can definitely revolumize, and it can also help lift up in certain areas of the face to give you that liquid facelift. So the first area I like to inject is the temple area. So if you look in some patients, they have some temporal hollowing or some volume loss in this area. So I can inject typically a half to a full syringe per temple to fill in that area. A lot of people neglect this area, but it's an area once you revolumize it, it definitely gives you that rejuvenated appearance. The next area I love to inject Radiesse is the cheekbone area. So I inject anywhere from a half to a full syringe per cheekbone. And by injecting the cheekbone, you get a very nice natural lift of your cheekbone, as well as give you that Hollywood cheekbone look. And also what that does is it draws your attention away from the folding around the mouth here. And that's the next area that I love to inject is around the mouth. So by injecting up here and injecting here, you're definitely revolumizing and you're rejuvenizing the face. And the same entry point from here, I usually redirect my non-bruising blunt tip cannula down across this way where the marionette lines are. So by injecting the marionette lines, you get a nice subtle lift of this angle of the mouth. The last area that I like to inject Radiesse is the jawline. So you have these little jowls that form here as we get older. And what I do is I inject after the jowl and before the jowl to give you a built-up, straighter jawline appearance, and also helps to, it's a great technique to help rejuvenize and make you look younger. So moving on to the next product is Voluma. Now Voluma received its FDA approval 3 or 4 years ago. I've been actively injecting it for my patients. And it's a hyaluronic acid that's very highly cross-linked and can last up to 2 years. It's typically anywhere from a half syringe to 2 syringes per cheekbone that I inject to give you that nice lifted appearance. It's typically my go-to product in my younger patients. You can use Radiesse and Voluma. There's a lot of crossover between them, but in particular I like it for my younger patients. I feel it lifts better. It gives you that more youthful look. It's a very natural type of looking product. So that's in a nutshell between those two products. I've injected numerous thousands of syringes of these products over the years. And I feel that they're great for facial contouring, for lifting the cheekbones, revolumizing, and making you look great. Thank you.